Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One of the most common conditions I treat is sacroiliac joint dysfunction. Sacroiliac joints are the two joints formed by the sacrum and the pelvis. These are the two little bumps you feel when you palpate in your lower back, kind of right below the belt line. The sacroiliac joints extend down about an inch. And these are very important joints because a lot of motion occurs in this region. When we're sitting for long periods of time and we're going from a sitting to standing position, rolling over in bed, picking up something off the floor, all that motion occurs in this region. So if these joints are not in the right position or not moving correctly, it'll cause lower back pain right in that area. And a lot of times patients can often pinpoint the pain. They'll put their thumb on it and they'll say, this is where it hurts. And that's often the sacroiliac joint. It can also disperse pain right across the belt line too when you're dealing with this condition. Sometimes also patients will describe it kind of wraps around to the front of their hips and they'll kind of almost like a C kind of clamp all the way from the back to the front. And that's another sign that the sacroiliac joint is a problem. Now what we do in our office is we provide a chiropractic adjustment to align the joint and restore the normal motion. This takes away the pain and helps to free up that mobility. One of the problems is that sacroiliac can shift back out of position and then start causing pain again. Especially if you've been dealing with this condition for a long period of time, the ligaments can become lax and then they're more prone to shifting out of position. Also, women are more prone at this condition because they have more joint mobility and more laxity. Same thing with pregnant patients. This is a very common thing we see with pregnant patients. And that's because, again, their ligaments are loosening up for the delivery and the joint kind of easily shifts out of position because of the laxity in the ligament. One of the ways you can treat this condition at home is to use a sacroiliac belt. And the belt that I recommend for patients is the Serola SI belt. The Serola belt is a SI belt that goes around that hip region there and provides compression of the joint and helps to give it stability. Providing stability to the joint helps relieve that pain and allows that ligament to heal and to help get in the right position. The SI belts are great because they help to allow your body to heal at home, but it still allows you to go through your normal ranges of motion throughout your daily activities. It can be worn either underneath your clothing or above your clothing. And it's about a 2.5, 3 inch belt, so it doesn't extend up pretty high like a lumbar belt. And the difference is a lumbar belt is going to be much bigger, it's going to be more uncomfortable because it goes across your abdominal region, whereas an SI belt is going to be kind of right at the hip level there. So it's not going to weaken your core muscles if you wear this for extended periods of time, and it allows your core muscles to actually function correctly, but also gives that stability there. Now, one of the keys to wearing an SI belt is to get the right size. So there's 4 different sizes for the Serola belt. So what you're going to want to do is measure your hip region and then correspond that with the belt size that would be correct for you. And that's going to get you the right amount of compression and the right amount of stretch on that area to give you that stability. So now what we're going to do is we're going to show you how to apply the belt to get the right amount of pressure right at the SI joint. So this is what the Serola belt looks like, and so you can see compared to an average lower back belt, this is going to be much thinner, and again, this is actually really quality premium materials. That's why I recommend this brand. So what we're going to do is we're going to demonstrate it, how to apply it to Renee. And so what I'd like you to do, let's have you turn around and face that direction. So again, the key is to find the SI joints. So again, the telltale sign of you finding the SI joints is that little bump you feel. And again, that's the top of the joint, and the joint extends from there down to about 4 inches. And same thing from here, maybe about 3 to 4 inches down is where the bottom of it is. So we want that belt kind of right in that area there. So let me have you turn around here and face this way. What we're going to do is I'm going to find that spot that we just palpated, and I'm going to have you grab for me the front portion. And what you're going to do is just secure that right at that level. Perfect. And next what you're going to see is on the Serola belt, there's these added compression straps. So we're going to pull this out and we're going to add some compression to that, and that's going to just give it more stability. Perfect. And that's how you wear the Serola belt. Again, you can wear it on top of your clothing or you can wear it underneath. It doesn't matter. It's going to provide the same amount of compression. But this is a great option if you're dealing with sacroiliac joint dysfunction. So Renee, how does the Serola belt feel to you?
It feels like it's adding some support, like it's just giving a nice gentle hug around that area. Feels good.
Yeah, it's a great product. Again, if you're dealing with any kind of pain like rolling over in bed, getting up from a seated to standing position or bending over. This just provides enough compression to take the pressure off the joint and allow that ligament to heal. So if you suffer from sacroiliac joint pain, or you have that pinpoint pain in your lower back, either on the left or right side, the Serola Belt is going to be appropriate for you. If you have any more questions, reach out to me at 703-912-7822 or schedule online at novacarwellness.com.